Guten Tag, meine Herren und Damen. Und nein, ich habe keinen Fehler gemacht. Ich möchte das sehen. I've been waiting all day long to say that, by the way. Welcome. Hello, everyone. My name is Minous Hossein-Zadeh. I'm a reproductive endocrinologist at the Fertility Institute of San Diego. I have been doing this for over 25 years, and one thing I'm very passionate about is third-party reproduction, egg donor, and surrogacy. You're going to meet a lot of people and clinics, and we essentially all pretty much do the same thing. A lot of the clinics have amazing success rates. We have people that speak many languages in our office. I tried a little bit of German today. We have an amazing team of embryologists. Between the 5 of them, they have over 90 years of experience. And I'm double board certified in OBGYN and reproductive endocrinology and infertility. And everything that we have is in our office, our Quad A certified surgery center, the IVF lab. But I think we all pretty much have that. So if I were an intended parent sitting in the audience, there would be 3 things that would be really important to me, and that's what I'd like to talk about. Number 1 is how easily can you have access to your physician? Is it just the initial consultation, and then after that you have different nurses or coordinators that contact you? My practice is different in that it's a boutique practice. I'm the only physician. I'm a little obsessive compulsive. I say at least I know what disease I suffer from. And I have to have my hands in everything. You have my email. We do frequent video chats together. And I'm the one who's communicating with you. I tell you about how your egg donor is doing, the number of eggs we harvested. I'm the one who will call you to tell you what the fertilization rates are the day after the harvesting, after the embryo Olympics, how many embryos made it to the blastocyst stage, how many we ended up biopsying. And I think for me, if I were a patient, that's really important. And it's even harder for you because you're not even in the same country as where the care is being provided. So to feel comfortable that you have access to your physician at all times, for me that would be a must. The second thing that would be important to me is, you're paying all of this money to choose an egg donor and a gestational carrier. Well, who's taking care of the egg donor and the gestational carrier? Who will see them at every single visit? Who does their ultrasounds at every single visit? And who ends up doing the procedures on these patients? In larger groups, it's usually a lot of nurses that do the ultrasounds. Bless you. Gesundheit, I should say. It is the, ultrasound technicians. But in my boutique practice, I do all of that myself. So I'm doing all of the ultrasounds and all of the procedures, and by the same token, I'm the one who's communicating with you about these. And for us in medicine, continuity of care is one of the most important keys to success and having a successful outcome. So that would be an important question if I were sitting in the audience to ask your prospective clinics. And, the other thing that's really important is to have that relationship that you should have with the entire team that's taking care of you. We welcome you to our office. You don't have to come if you don't want to, but I highly suggest visiting La Jolla in San Diego. It's the most beautiful place in Southern California. La Jolla means jewel, so it's the jewel of California. And, If it's too hard to come, most of us work with clinics in your own countries that could do the FDA testing, draw the blood for the genetic carrier screening, and freeze the sperm and ship the sperm to us as well. So that's something that can be done. The third most important thing for me, if I was again sitting in the audience, would be to work with a clinic that stands behind the results. And what do I mean by that? We're on the path. We all share the same path, and the goal is to have a baby at the end, and your baby is just as much our baby's. And by standing behind our work, I mean that we have what we call a 2 feet at a time guarantee, in that if for whatever reason you're not successful, you actually get most of your money back for the medical part of the treatment. And we believe in the work that we do, and that's why we offer that. So that's basically who we are, what we're about. As I said, I've been doing this for over 25 years, and every baby that we bring into this world, it's as if we're doing this for the first time. We're so excited and happy about this. If you have questions about the process, I would like to take those if you'd like. I know in the larger group setting it's a little more difficult to ask questions, but feel free to ask. Yes?
You're a fertility institute. How do you find surrogates in this case?
So we work with a lot of agencies, and we make the recommendations for you. There are two scenarios. One is an in-house surrogate or egg donor that you could use, or use agencies. I choose to work with multiple agencies, and we've vetted them for you. And the reason is because there's a much wider selection of people that you have access to. And, there isn't as much conflict of interest in that you're forced to have to use the in-house people. And depending on which agency you pick, recently I've had someone find a surrogate in as little as 2 months. But depending on your criteria, it may be a year or a little bit longer than that. But for the most part, we're able to find surrogates very quickly. As part of that journey, something else that's really important is to try and find local surrogates or egg donors local to the clinic that you're going to, because that would significantly reduce the cost. So you're not paying to fly out the egg donor to have her screening done. You're not paying for her to go back for the treatment, for example. And I go over all of that with you. You're all welcome to, stop by our booth. We can do our complimentary consultations. And I guide each one of you through that process depending on what your situation is. And it's really a learning opportunity to gather as much information as you can. And then you decide where to go from there. But we have your back, and our job is to empower you with knowledge by giving you as much information as we can. And, you can call us as many times as you like. It's not just a one visit and that's it. And, even throughout the process, we're always available. You're welcome. Yes?
How do you typically start? Do you start with looking for a fertility institute and choose one and then go from there? Or do you normally start with an agency and then they recommend you a clinic? What would you recommend? Because that seems like, yeah.
Sure, very good question. So my recommendation is to start off with the clinic first. Why? Because you have to choose and it's a relationship again. Who would you like to work with for the next year or so practically? And then if you trust your physician, then he or she will make recommendations of agencies. But that's my personal preference.
Okay.
Yes, you're welcome.
It may be a naive question, but the egg donor gives like one egg or multiple?
Multiple. So you should come to, I'm speaking on a medical panel tomorrow about egg donation. So the goal is always for your egg donor to go through one cycle and for us to harvest as many eggs as we can from her to create multiple genetically normal embryos. And that way, if 2 or 3 years from now you'd like to have another child, then you don't have to go through the whole egg donor process again. We've already created the embryos. And that's one of the benefits of using a fresh egg donor versus buying eggs. But they go through a stimulation process, and yes, we harvest as many eggs as we can. Who was first?
If I just connect to this question.
Yes.
So you also offer to freeze and store embryos?
Absolutely.
So genetically connected siblings, they don't.
Yes, and they can remain frozen for years. Mhm.
Yeah, so it's also related to that.
Yes.
So that means, that means that also you will have usually to pay for the storage of the embryos, like until they're being used.
Yes. But that's a very small fee. And it's a good fee to have, actually, because then you know that, you have insurance, you have extra embryos available. And whenever you're done with having children, then you decide what to do with these embryos. Donate them to other couples, discard them. Those are the main options. Yes.
So, and also, if you have these embryos, you need to have only one sperm donor for these, or multiple.
So-
Multiple is a lot, but two.
Well, usually 2, yes, 1 or 2. So with 2 dad scenarios, the beauty of using a fresh egg donor is that because we get like 25, 30 eggs, we can split the eggs between the 2 sperm providers. And that way, each intended parent has their own biological children. And in a surrogate, this is the one time where I actually transfer 2 embryos. Usually it's just 1, though. 1 from each intended parent. Because surrogacy is expensive, as you know. You wanted to be parents yesterday. So,
Is it possible to, if you want to have twins, is it possible to have it from one and the other there at the same time?
so yes, that's what I was referring to, transferring 2 embryos. But the standard of care is elective single embryo transfer, ESAT. But this is the one situation where we do consider putting back 2. Yes.
So the egg donation, that's something where you also have agencies who work with you? Or
Yes.
is that something you said in-house? You have possibilities not to go to an agency, but you can provide this as well?
So I work with agencies for that as well.
Okay. So the in-house was rather for the...
Another option that you have in some places,
Okay.
which is a more limited option.
Yeah.
The data bank is not as large, so.
But for the surrogacy, you said there are some in-house options where you don't need to go to an agency, is that correct?
That's correct, but I work with agencies,
Okay.
yes. So the agency will take care of whatever your needs are. An egg donor, a surrogate, the legal part of everything, which is just as important. Yes.
Hi, just a quick follow-up question to what was asked before regarding the twins specifically. What would you say are like the advantages, disadvantages, risks associated with
Transferring to?
Yeah.
So there's always the possibility that one of the embryos will split. There's a less than 5% chance. Excuse me. Where's my water? So there is a less than 5% chance that the embryo will split. and you can have triplets. If both of the embryos split, then you can have quads. For us, 3 and more is a very high-risk pregnancy. And that's why the standard of care is ESET, elective single embryo transfer. With 3, we always, recommend the gestational carrier, the surrogate, to see a perinatologist, a high-risk obstetrician. And the perinatologist will go through the risks of what could happen if you keep all 3. They can go into preterm labor at around 20 weeks. They're usually admitted to the hospital from 21, 22 weeks because they want to prevent the surrogate from delivering. The worst case scenario for me would be, God forbid, if she goes into labor at 23, 24 weeks, then you could potentially have 3 developmentally handicapped children to take care of for the rest of your lives. And that for us is not a success. And that's why standard of care is the transfer of a single embryo. But, so with that said, if 3 implant, another option is selective reduction. So if you're looking at potentially transferring 2 embryos, it would be good if your surrogate is amenable to selective reduction. And that's a procedure where they reduce from 3 down to 1 or 2, so that the other 1 or 2 have a better chance of survival. And we go through all of these scenarios when we decide, how many embryos to put back. So the ideal scenario would be 1 embryo at a time. We also do, cases where you have 2 surrogates going through this at exactly the same time, and we do the embryo transfer on the same day, 1 from each partner in the 2 DAT scenario. That would be the safest way to go. But we go through all of the options with you. I'd be more than happy to speak with you afterwards. We can do a complimentary consultation. These are things that we spend a lot of time reviewing so that you know the pros and cons of all of the decisions that you make.
Wonderful. So we have to wrap up for the next session. If you have more questions for Dr. H, you can find her in the expo room, or Joanne, and they'll be able to answer any of your questions there. Okay, thank you so much.
Thank you. Thank you very much. Thank you.